Hi, my name is Jamie Hunter. I'm a registered nurse in the operating room, and the questions I'm going to be talking about and concerns I'm going over are in regards to on-call hours for nurses in the operating room. As a CNOR, which is a certified nurse in the operating room, I know that we go by AORN standards, and that is like our Bible. So that is why my first choice is to ask an AORN member about the guidelines for it. And so I understand that your position statement is nurses should not be required to work in direct patient care for more than 12 consecutive hours in a 24-hour period and no more than 60 hours in a work week, 7 days. And all work hours include regular hours and call hours worked. And so my concern is how is this being monitored? Who necessarily looks at this, and how is it regulated? So I looked at some OSHA standards and some Texas Board of Nursing standards, and nothing is as specific as AORN is. And so can you tell me what policies exist for nurses working in the operating room and call hours? And, Alma Allen, the Texas House Representative, recently created a bill that will be passed September 1st about safe patient handling practice. And so in my mind would safe patient handling include call hours? Because we all know that safety is our number one concern for patients. And is this a realistic thing to monitor? Is what nurses are required to work, and do places of employment enforce this? And are they even aware of it? Do you think that if there is too strong of a rule for it, this would not allow nurses to work the extra hours that may need to make extra money? Or is this the best thing for overall for everybody? With these regulations in place, is this practical with the shortage of nursing and having extra staff to fulfill these needs? And, would you consider sponsoring a bill like this, or even consider looking at this and putting it on an agenda? My concern is the amount of hours and put forth in a 24-hour period, because it is required to take call in the operating room, and the workload and the patient acuity, does that play into everything? Thank you so much for your time.